The American College of Cardiology is recommending that a new test become a standard alongside cholesterol testing in determining heart health. We're joined now by our chief medical correspondent, Dr. Tara Narula, who is also a practicing cardiologist. So tell us about this study from this group and why they feel it should be part of blood work.
Well, I was very excited to read this yesterday as a cardiologist, and I think it's going to be game-changing for how we practice and for what patients should be asking for. So this was a statement that really talks about chronic, low-grade silent inflammation being a real driver of cardiovascular disease. In particular, that inflammation is responsible in large part, for the formation of plaque in our blood vessels, for the potential rupture of that plaque that causes things like heart attack and stroke, and even heart failure. So we need to do a better job at treating inflammation and screening for it. And so this statement really highlights the use of a simple, widely available, low-cost blood test, one that's been around for over 70 years. It's called the high-sensitivity CRP. CRP is a protein produced by the liver. It is a marker of inflammation. It does not cause inflammation, but it tells us how widespread it is in your body. So if your high-sensitivity CRP level comes back at less than 1, you're in a low-risk category. Anywhere from 1 to 3 is sort of moderate or average risk, and above 3 is considered high risk. About 40 to 50% of Americans are walking around with an average or moderate level of CRP, that 1 to 3 range, 15 to 20% of adolescents. And so for a lot of people who think my cholesterol is well controlled, I'm in a good situation, this tells us, the studies have shown that even if your LDL, your bad cholesterol, is well controlled, if you have a high CRP, you are at risk, is a great predictor of future cardiovascular risk. And in fact, for those individuals who have known cardiovascular disease, research has shown that CRP may be a better predictor of future heart attack and stroke risk than even the LDL cholesterol.
But what if you have a high level of this protein? Is there anything they can do to control it?
So researchers are looking at how do we stop the pathways of inflammation. They're looking at different drugs to do that. But in the meantime, what's in your hands? So lifestyle is a big way to reduce inflammation. So diets like the Mediterranean diet, the DASH diet, that focus on legumes, nuts, olive oil, fatty fish, those omega-3s, that's important. Reducing red and processed meat, refined carbohydrates, avoiding smoking, maintaining a healthy weight, and exercising. There are studies, as I said, they're looking at medications, but statins, we talk about for cholesterol, lower CRP. And so even if you have, again, a well-controlled LDL, regardless of what it is, you may want to be intensifying or taking statins to reduce your CRP.
It comes back to lifestyle. And sometimes people are so dismissive and going like, oh, we hear this all the time, but people have to realize the difference it can make.
You have so much power in your own hands about how you live.
Yes.
Correct.
All right.